in general, and what I talked about a little bit in lecture, was if this is the pelvic girdle, represents the bony part of the outer tube of the body. And what you'll notice is that, and there's this, what we literally call the pelvic canal going through here, but we would expect it to be in a cranial caudal or superior inferior orientation, but it's not. It's tilted forward. And that's because, like I was saying in lecture, we're really bipedal or have upright posture, walk on two legs from the lumbar region up. Our pelvic girdle is very much in the same position as it would be in any one of our other four-legged mammalian relatives, reflecting that shared common evolutionary ancestry, where if we don't have a mounted skeleton of a cat, I wish we should get one, or a cat or a cow or any of those animals. If you can imagine, the vertebral column would come up very much in this orientation, and then you have kind of that rounded C-shaped vertebral column. It doesn't come straight out this way, it's kind of just right at that angle. And in fact, that's the angle that we would see in a human infant, in a newborn baby, all the way up to somewhere around a year of age. And that's how they sit there with that nice C-shaped, vertebral column, and they're very comfortable just seated like that, or that almost fetal-like position of the spine, or of the vertebral column. But then, around a year of age, there's a differential growth of the lumbar vertebrae, creating what we call this reverse lumbar curve. And it's a matter of, it happens somewhat quickly, like weeks or months, but it takes a while to get it completely done. And that's when that baby becomes capable of starting to learn to walk, because that's what brings the weight of the trunk up over the pelvic girdle and over the lower limb. And until that happens, the baby's not going to walk. And sometimes it happens pretty early, as early as maybe 8 months, and sometimes a lot later, like a year and a half. And you get those parents all worried, my baby doesn't want to walk or whatever, and it's probably because they're not getting their weight over their legs until they have some of that reverse lumbar curve in place. And then if you've seen like a baby learning to walk, it doesn't happen overnight, so it's gradual, and a lot of times they're still tilted forward a little bit because it's not totally in place, and so they're usually tilted forward a little bit, and they even do that little tippy toe thing because they're kind of catching up with themselves. The good part of that too is that it means when they fall, which they inevitably will when they're learning to walk, they're pretty much falling forward and not, falling backward and whacking their head. So that's what brings us into this bipedal posture, where we walk around on two legs. And it also means, in terms of just getting the pelvic girdle oriented, it's kind of, you got to think about that. It's almost in this, it's not in this vertical position. Having said all of that, what do we have? We have what's called this part down here, what sometimes we just call it the pelvic canal, but we also know it as the minor or true pelvis. Minor in this case meaning just the smaller part of the pelvis, and true, not like it's true or false, but just like the main core part. And then when you include the expanded, these iliac blades in this whole region out here, we call it the major, meaning the larger kind of pelvic region, or the false pelvis. We talk about the pelvic inlet, this part here, and then we talk about a pelvic outlet back here. But in life, this pelvic outlet actually has a muscular floor. This is kind of A&P2, that's when we'll see all of this, because that muscular floor is where all of the visceral organs that have a connection to the outside world would pass through there. In other words, what I'm talking about, and again, this is A&P2, but just to sort of get the reference, through this pelvic canal would go the rectum leading to the anus, or the tail, for the tail end of the digestive or gut tract where feces are expelled from the body. That would be most kind of posterior or up against the vertebrae. Anteriorly, just behind the pubic symphysis here, would be the bladder and the urethra going through there. In females, a straight shot through the muscular pelvic floor. In males, the urethra enters into the base of the penis and out to the tip of the penis, and that's where urine is expelled from the body. And then, of course, only in females you would also have the uterus passing through here. Actually the uterus leading to the vagina, which would pass through here, which in a pregnant woman at birth becomes what we call the birth canal, and expands out and comes to fill almost that whole there's incredible flexibility to fill almost that whole pelvic canal with a very tight fit between especially the bones of the baby's skull and the way they fit through there. Again, all A and P2, but just to kind of give you a perspective on what this region is about. So in terms of what we want to know for now is the musculoskeletal anatomy, and in the skeleton in particular, you've got the sacral vertebrae forming the back posterior part of this. They're fused, right? 5 fused vertebrae. And then fibrous joints that attach these 2 bones on either side, which come around to the pubic symphysis at the front. And these bones, they have a weird kind of naming history. Sometimes they just get called the innominate bone, which means no-name bone, the whole bony piece. Sometimes we just call them the pelvic bones. And then maybe most correctly anatomically, there's something that's called the os coxae, but that's confusing to me because these are the coccygeal vertebrae. They're actually the tail vertebrae, so it's using the same sense of it being at the tail end of the body, so there's some confusion there. And so it turns out most commonly it's not very common we even refer to this whole bony structure. We refer to the separate parts of it. And when we do that, we tend to talk about the hip joint where the femur would come in as being the central part of this. So on this side, the femur's attached. That's where you can see that ball and that socket part of the ball and socket hip joint called the acetabulum. And just like in the shoulder, this is the only ball and socket joint in the lower limb with that full, all 3 ranges of movement: abduction, adduction, flexion, extension, and that lateral and medial rotation of the hip. But a much more complete bony socket here, and the head of the femur would fit in there. And then from there, you get radiating out superiorly the big kind of blade. It's literally called the iliac blade of this part of the bone called the ilium. And these 3 parts all form as separate bony ossifications during fetal development. So they all come together right at that acetabulum. So that's the ilium. I think of it as the hands on your hip bone, because if you rest your hands on your hip like this is exactly where you're resting them. Right at the front, you have that ASIS, or anterior superior iliac spine, which we saw at the inferior extent of the abdominal wall, forming that inguinal ligament across there. So that helps me remember that too. So that's the ilium. Extending posteriorly is the ischium, again from the acetabulum, this bony piece coming back here, and this is called the ischial tuberosity, and that's what you're sitting on. It forms the bony part of your buttocks. Okay? In life, it's got that big gluteus maximus muscle that we'll see on the cadaver that does that hip extension, covering it, and then a big fat pad over it. But the actual bony part of your skeleton that you support when you're sitting would be this ischial tuberosity, extending posteriorly. And then extending anteriorly is the pubic bone, or the pubis. And that's what meets from the right and left sides at what's called the pubic symphysis. A symphysis joint, if you'll remember, is by definition a fibrocartilage joint. So it's really virtually no mobility with that very tough fibrous cartilage joining the 2 bones together there. I don't know how well you can see that all from the perspective you're at, but there is also a piece of bone that connects the pubic part to the pubic symphysis, basically back to the ischial tuberosity, a little branch or ramus called the ischiopubic ramus. And that word, that's a Latin word for branch. Spanish speakers, ramo, means like the branch of a tree, ramus. Okay. So that's kind of the parts of the pelvis. If you look, you can see all those on the isolated pelvis too, if it's helpful. The acetabulum, the iliac blade, hands on your hips there, coming superiorly, the ischium going inferiorly, the bony part of your buttocks that you're sitting on, and the pubic part going anteriorly to meet the other side at the pubic symphysis, and of course the sacral vertebrae fused as the sacrum back here.